Dr. Kyle with Project Wellness Company. What we're going to talk about today is low back, and the specifics of why I want to focus on low back today is because in the last 6 months we've had a transition from having an ergonomically correct desk at office, and now we're working from home. And all too often, our workstation at the office and our workstation at home are totally different. We may have a standing desk at the office where we can get up, move around. We have interaction with other people, so we're able to go and go to the copier, the printer, and just get up and move a whole lot more. But now that we've transitioned to more being at home, your workstation at home is vitally important when we talk about your low back. And the biggest reason for that is your posture. Okay. Your head is approximately 10 to 15 pounds. And so when your head's over your shoulders, okay, where it's supposed to be. So if we look at the spine here, we should have a nice C-shaped curve in the spine. And when your head's over your shoulders, okay, it's going to be 10 to 15 pounds. Now, for every inch that head comes forward, it's going to gain 10 pounds of pressure. And because your low back is on the other end of that lever, okay, so it's at the bottom here, for every inch that the head comes forward up top, it actually adds up to 100 pounds of pressure to your discs in your low back. And so when we're sitting at home and evaluating our workstation at home, it's going to be vitally important to make sure that our station is set up in a way that's going to be the best for our posture, best for our spine. Because if we're finding that we're having to reach far forward and we have a rounding in our mid back, that's going to put a lot of unnecessary pressure in that low back. Now, if it was to only happen for, a couple minutes or a half hour throughout the day, that's not terrible. But if you're doing that for 8 hours a day, 5 days a week, that's going to put a lot of unnecessary pressure in that low back. Now, if you think about having an extra 100 pounds of pressure on your discs in your low back, 8 hours a day, 5 days a week, that's going to over time start to lead to a lot of different issues. And that's one of the more common things that I've seen in the last 6 months from existing patients and new patients, that they weren't dealing with these things, a year ago. They've only developed since they started working home. And a lot of them are sitting on their sofa, they're sitting at the kitchen table, just trying to find a spot to work because they thought at first it would be temporary having to work from home. And now it's transitioned to maybe even more of a long-term thing. And so making sure that that workstation is set up correctly to eliminate the potentials of having low back pain develop because of a posture-related thing when we're sitting. And so evaluating that and looking at that at home in your workstation is going to be super important. And on a correctional standpoint, there's a lot of things we can do in office to work on that. Ultimately, if the spine's coming forward and there's pressure put on those nerves, that's something directly what we would work with in the office. There's certain exercises, stretches, mobility, flexibility, things like that we do alongside of adjusting to help strengthen the muscles in the low back, stretch certain muscles in the hips and the legs in order to make sure that low back is as balanced as possible. So that way we can make sure that everything's working correctly and we're not having issues in that low back.